So let's talk a little bit about where the chiropractic story starts. Because for me, being a woman, being a mom, being a chiropractic warrior that loves to see women and children and families of all ages in my practice, when I tell the chiropractic story, there's only one place it starts, and that is at the instant of conception. Because when you have a man and a woman come together, and their cells are so innately driven, they are so smart, they are intelligent enough to come together, do you understand that you can have 2 million sperm cells fighting for the opportunity to get into that egg? And that the egg is so smart that the instant she chooses one of those sperm cells, she closes so that no other sperm can get in, so that it doesn't mess up the process. That's innate intelligence right there, because we can't create that. And when the egg takes that sperm in, and it starts to multiply and divide and multiply and divide, you all should know, what is the very first structure that develops in the baby? The brain, followed immediately by the spinal cord, the nodal cord. Nothing else forms. You do not have a baby if that doesn't happen. So how can you not start the chiropractic story right there? Because it's that simple, that the brain and the spinal cord control and coordinate the development of every structure, every tissue, every cell in the human body. So the baby will not develop heart cells, lung cells, eye cells, arms, ears, nose, fingers, nails, eyebrows, eyelashes, unless the brain and the spinal cord tell the cells to diversify and to differentiate into those different cells. This is how intelligent the human body is. And during the course of pregnancy, the baby will continue to do all these wonderful things, growing and developing and dividing and multiplying to make all these cells. And then once the baby is born, the nervous system will continue to control and coordinate the function of every cell, tissue, organ, and system in the body. But what happens if mom was subluxated? Let's think about that. Because a lot of times we just talk about getting mom adjusted during the pregnancy and getting the baby adjusted during the birth and after. Let's think about if mom was raised in a subluxated home. Is her innate potential diminished, yes or no? Yes. Okay. What if her mom was subluxated? Yes. What if grandma worked on the farm, bending over, milking the cows, doing all this crazy stuff, hurt herself, and she had a subluxation in her low back, but she dealt with it, right? You know those grandmas that kind of walk with that slow walk, right? And grandma had mom, right? And she was subluxated. When that mom developed inside the womb, did she develop with her full innate potential, or did she develop with diminished potential? Diminished. Diminished, because mom was not able to send the proper nerve supply from her body to her uterus to give the baby all the building blocks that it needs. So now you have generation of grandma working in the fields, then you have the mom. She was subluxated from birth. She didn't get under care. She had a daughter who was subluxated from birth, probably didn't get under care until now she's 25 years old, she's pregnant, and she comes into a chiropractic office for the first time. How many rounds of antibiotics do you think those 3 women had been exposed to? How many types of chemicals in their food, their drinks, their aspirin that they took, the medications that they were given, the vaccines that they were given, do you think they were exposed to? We talk about there are 3 types of stress on the nervous system, right? 3 causes of the subluxation. You have your thoughts, your traumas, and your toxins. So if mom and grandma and great-grandma were full of the 3 T's, and each one had a diminished capacity, and then had a baby, and had a diminished capacity, and had a baby, and that baby had a diminished capacity. And now here she is, 25 years old, in your office, been subluxated for 3 generations, and she wants to get under care. Do you think that the adjustment that you're going to deliver can affect the generations going forward? I mean, are you getting goosebumps or what? Yeah. Right? Because you will affect generations going forward, because you're talking about subluxated, 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 drugged, 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 vaccinated, 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 living in an outside-in world for 3 generations in a row, but somebody makes the choice to stop it, and they come in your office. And if all you do is say, I'm going to get you adjusted so that your back doesn't hurt while you're pregnant, did you change the generations? No. You just left them on that same path, that downward spiral. But if instead we get out of our comfort zone, we tell the story, and we explain that life starts from the instant of conception, that the brain and the spinal cord are the first structures to develop. And so we have to protect that. We have to make sure that the body is capable of doing all that it's supposed to do. And we have to keep the nervous system flowing freely, uninterrupted, with no interference whatsoever, so that that baby can develop within the womb with the maximum potential. Do you think mom's going to listen and get that? Right? Because they may come into you because they've got back pain, or someone told them that women under chiropractic care require 50% less pain medication during their birth, or that women under chiropractic care have 38% faster births than women not under chiropractic care, because these are statistics that are out there. And the great part is, you know who's putting out those statistics?
The MDs.
The MDs, the OBs, right? So that's great because they're validating it for us, right? Going back to that, there's not enough stuff out there. They're validating it for us. As much as they don't want to, they can't help but to, because it's out there. And women that are under chiropractic care, they're better adapted to handle what's going on with the process of the birth. So let's talk about the birth process, because you are going to have women that come into your office that are going to ask you questions. Whether you want to get into the discussion with them, or you want to give them books from your lending library, or you want to send them to somebody, you do have to have a bit of an understanding, right? See, on TV, they make it look like labor is this, oh, God, killing me, like, horrible, horrible thing. Because they don't understand what's going on. If you understand what your body is doing and you do not fight it, but you relax and you go with it, labor is beautiful. There is no pain involved. And this coming from a woman who had an 8-pound, 8-ounce son and a 10-pound, 3-ounce girl. At home. Okay? I can tell you. In labor, adjusting at the office, contractions 2 minutes apart, and I'm literally on the patient going, waiting for the contraction, right? And the patient's like, "Doc, you're crushing me." I'm like, "Shut up." Honest to God. And my midwife is calling the office going, "Can you tell Dr. Cathy to go home yet?" And they're like, "No, she's jam-packed with patients. You know, she's not leaving." And they're like, "Do I need to come to the office to have this birth, or is she going to go home?" They're like, "We'll keep you posted." You know, my husband's at a screening, so he wasn't even there with me that day. And they're like checking in with my husband. They're like, "Can you kind of wrap up that screening?" He's like, "No, you know, we're at the high school." They're like, "Okay, I figured the two of you are both going to say no, right? We got to stir, right?" So I'm at the office, I'm adjusting, and at one point I go and I sit down, because when you understand the process of birth and you want to do a natural birth, and you follow something like the Bradley method, you understand that the body is doing something very smart. It is actually contracting to push the baby down. So the uterus contracts from the top to push the baby down. And if the baby is head down, feet up, the baby's actually using their feet to push themselves out of your uterus. The worst thing you can do is tighten up and resist it, right? Because now you just resisted the body pushing that baby down. The best thing you can do is just relax and let it happen. So at one point I actually sat down at my desk in the middle of one of the contractions, and I just kind of sat there for a minute, and some guy comes in, he's like, "You know, I just went to my MD the other day, and I had some blood work done. I want to talk to you about it." I was like, just get out. I was like, I don't have these conversations. I'm certainly not going to have it today, right? Because normally what I would say is, okay, go back to your MD and tell him that you're under chiropractic care, and things are going pretty good here, so he can look at whatever he wants, right? Because we don't deal in the disease. Medicine is looking for the cause of disease. We should be looking for the cause of health. Because there is no cause of disease. The cause of disease is the lack of health. And if you don't believe me, what is the cause of darkness? Lack of life. Lack of life. What is the cause of cold? Lack of heat. It's not wind. Because it could be windy as you know what on a sunny day, and it'll still be warm. If it's a summer day and you have a huge windstorm coming in, it'll still be warm. So it is not that there is a cause of disease, there is a cause of health. And the lack of health, the lack of the innate potential in that human body functioning at its optimum level is what's going to give you disease. Because your body will adapt in a maladaptive manner. So when we talk about the women that are pregnant and why it's so important to explain this to them, they need to understand this is not about back pain, it's not about alleviating their nausea, it's not about making their labor or their birth easier. While all of those things are great and very attractive to women, it is about increasing the innate potential of that baby. You realize you have 40 to 42 weeks to build a human being. That's it. If you don't provide all of the building blocks in that time frame, you can't go back and get a do-over. You know? And your patients are going to be bombarded. The very first visit they go to when they find out they're pregnant, they call it the FOB, the first OB. What does an OB do for a living? What does an OB do for a living? What is their training? Are they a medical doctor or are they a surgeon? They are a medical doctor who's trained in surgery. An OB is a surgeon. Why is the first appointment women are subjected to when they find out they're pregnant? To meet with a surgeon. Why are we planning out a surgery 40 weeks from now?
Because they're considering the pregnancy as sickness.
Because they consider it sickness. That's exactly it. And is pregnancy a sickness, or is it a normal stage of life that half of the population on the planet Earth is capable of going through? Right? So we treat it like a sickness. And the minute they get into that first OB, that FOB, what they do is they start instilling fear. They start telling them all the things that can go wrong, and when they're going to be tested, and when they're going to be expected to be back in this office, and when we're going to do your blood work, and when we're going to do your urine analysis, and when we're going to do your genetic testing, when you're going to do your ultrasound, when we're going to do your amnio. They put the fear into them that your body is not smart enough to create a baby. Is that insane? But yet women don't know it's insane because that's what their girlfriends did, that's what their sisters did, that's what their moms did. So they fall into that routine, not even knowing that there's another way. Many women don't know that they can go to a midwife. Many women don't know that they can have a midwife and have the OB just as a backup, God forbid they need something, right? Because medicine is there for crisis care, and that's where it should stay. It does not belong in a healthcare system. When we're talking about pregnant women, we do not need to start putting the fear of God and the fear of their baby dying into their minds. Because what is that going to do? It's stressing them out. And if they're stressed out, what is it doing to the development of the baby? Interfering. You know what is the absolute worst thing that could happen to a pregnant woman while she's pregnant? Be under stress. Because what does that do to the developing baby? It increases the amount of testosterone that is produced in that baby before it's even born. What do you think increased testosterone does to a baby once they're born, especially if it's a male child? What does it do to the brain? Right? ADHD, ADD, that's what they're starting to talk about, because what's going on is one side of the brain has too much testosterone, the other side of the brain is functioning normally. So these are the kids that can sit and stare at a video game that's flashing like crazy for hours, right? Totally zone out. But you put them in a classroom and they're like bouncing off the wall because they don't have enough stimulation, because this side of the brain is going, come on, come on, come on, feed me, feed me, feed me. And the other side of the brain is like, that's okay, I can do this. Totally fine. Right? So when we start seeing moms stressed out, we start seeing that increased testosterone in the baby, we start seeing problems. Let's back up and not allow that situation to happen. Because you know what happens when they see a kid that's not conforming? What do they want to do to them? They want to medicate them. They want to drug them. You've got to start educating the women when they're pregnant, before that baby hits second grade and the teacher says, your kid's a terror. You've got to educate them way before that. It starts when they're teenagers. It starts when you first meet them. It starts as soon as you get the opportunity to talk to them about lifetime care for everybody, so they can understand that it's not about neck aches, back aches, headaches, which is what the media loves to portray chiropractors as, but it's about being able to express health to the fullest potential.